You are probably carrying up to 11 pounds of stagnant fluid in your body right now, and no one is telling you. You wake up puffy, your ankles swell by afternoon, your face looks 10 years older than it should. You've tried the massages, the expensive spa treatments, maybe even those compression wraps that cost $150 a session. None of it worked. Here's the truth that no one in a clinic is going to say out loud. Your lymphatic system is the problem, and almost everything sold to you to fix it is a waste of money. The system profits when you stay confused and stay sick. They're not going to hand you this information at your next appointment. There's real money in keeping you dependent on prescriptions. Subscribe to Dr. Waterling and hit like if you want the truth without the filter. Help this channel reach 100,000 subscribers. I'm Sam Waterling, and I've spent 15 years watching this exact problem destroy people's quality of life. Not because it's incurable. It's not. Because nobody explains the actual physiology. So, let me do that right now. Your lymphatic system controls everything you think of as your health. Not partially, everything. Your energy levels every single morning, the clarity of your skin, the sharpness of your thinking, your immune response, even your mood. This is not exaggeration. This is basic physiology. Here's why. Your brain runs continuously, 24 hours a day, 7 days a week. It burns fuel constantly, and burning fuel produces waste. Broken protein fragments, dead cellular material, metabolic debris. If that waste doesn't get cleared out on schedule, your brain starts operating inside a bath of its own toxic byproducts. The result is what so many of my patients describe the same way. I wake up exhausted. I can't think straight until noon. I've been foggy for years. That's not stress, and it's not aging. That is a lymphatic clearance problem. So, let's talk about what this system actually is, because most people have no idea, and the confusion is costing them. Your cardiovascular system, your heart and blood vessels, is a closed loop. Blood leaves the heart, travels through arteries, passes through tiny capillary beds in your tissues, then returns through your veins back to the heart. It never stops circulating. It has no beginning and no end. Your lymphatic system is fundamentally different. It has a beginning and it has an end. It starts in your tissues as microscopic blind-ended vessels, tiny tubes that simply terminate in the tissue itself, open at one end, going nowhere at the other. These vessels collect excess fluid that leaks out of your blood capillaries into the surrounding tissue. Think of it as your body's storm drain system. When water accumulates where it shouldn't, these tiny drains collect it and route it away. The fluid that enters these vessels passes through microscopic gaps between tissue cells. It flows inward, picks up cellular waste, and begins moving toward the center of your body. Where does this fluid originally come from? Entirely from the water you drink. Your body needs large volumes of fluid to physically wash through its internal environment. That washing process is what lymph is. If you don't drink enough, there isn't enough fluid volume to move the waste out. The whole drainage system slows down and backs up. Stagnation begins. Swelling follows. This is where most people make their first mistake, and it's completely understandable, because the recommendation sounds counterintuitive. You're puffy, you're retaining water, so you think drink less water. That is exactly wrong. That logic is backwards. You need to give your body more clean fluid so the drainage system has material to work with. Dehydration is one of the most common causes of chronic edema. That's the medical word for swelling. Edema simply means excess fluid trapped in the tissues. Here is how to hydrate correctly for lymphatic function. Drink in the morning first. The reasoning is simple. Your day's physical activity is ahead of you, and movement is what drives lymph flow. When you move, your muscles contract. Skeletal muscle contractions, the squeezing of your leg muscles, your arm muscles, your core, physically compress the lymphatic vessels that run through those tissues. That compression drives lymph forward toward the center of the body, toward the heart. The more you move after drinking, the more effectively that fluid circulates. The water you drink in the morning should be hot, not lukewarm, not room temperature. Room temperature water is essentially cold relative to your body's internal temperature of 98.6 degrees Fahrenheit. You want water that is as hot as a cup of tea that you can comfortably sip. This matters because temperature carries thermal energy. When you drink cold or room temperature water, your body has to spend metabolic resources, actual cellular energy, to warm that water to body temperature before it can be used. That's energy diverted away from tissue repair and lymph movement. Hot water arrives at body temperature and goes to work immediately. How much should you drink? Start your morning with several comfortable sips, half a cup. If it feels right, finish the cup. Then walk around your home for a few minutes. Let your body respond. When you feel ready, drink again. In this way, over the course of a single morning, you can take in between 700 and 800 milliliters, roughly 3 cups, without any discomfort. If your body responds well, you can bring that up to a full liter of warm water before your day is fully underway. How do you know if you've had enough? Your urine will tell you. This is your free, real-time clinical test, and it's more reliable than most things a lab charges you for. Properly hydrated urine is merely colorless. It looks like very pale water. If your urine is yellow, gold, or darker at any point in the day, you are dehydrated. Full stop. Use that visual cue to calibrate your intake. Adjust accordingly. Your body has a thirst regulation system, and it's worth understanding exactly how it works. When salt concentration in your blood rises, meaning the ratio of salt to water tips too far towards salt, specialized osmoreceptors in your brain detect the shift. These are pressure-sensitive receptors that respond to changes in fluid concentration. When they fire, you feel thirst. But here is the critical clinical point. By the time you feel thirst, mild dehydration has already begun. Thirst is a late signal, not an early warning. The goal is to drink ahead of thirst. Sip consistently throughout the day, not in large volumes all at once. Your body will guide you. And in the overwhelming majority of cases I see in practice, the problem is not overdrinking. People drink far too little. Underhydration is the rule, not the exception. Now let's talk about where all this lymph actually goes, because understanding the destination helps you understand how to speed the journey. All lymph eventually converges into 2 major collecting vessels called the thoracic ducts, one on the right side of the chest and one on the left. These are the largest lymphatic vessels in your body. Through these ducts, lymph empties directly into the venous circulation, your veins, and from there it enters the heart. Once it reaches the heart, it recirculates and eventually gets filtered by the kidneys and excreted. The key insight here is how lymph actually moves through those ducts. There is no lymphatic heart, no dedicated pump. Lymph moves through 3 main mechanisms. First, skeletal muscle contraction. Every time you walk, swing your arms, or tighten your core, those muscles squeeze the lymphatic vessels and push fluid forward. Second, your respiratory cycle. Every time you breathe in, your diaphragm, the large dome-shaped muscle under your lungs, drops downward, increasing the volume of your chest cavity. That increase in volume creates a drop in pressure. Lower pressure inside the chest physically draws lymph inward from the body's periphery. Third, the rhythmic pumping action of your heart and the pulsation of nearby arteries help drive lymph through the vessels. So, if you want to powerfully amplify lymphatic flow, you need to deliberately enhance that chest suction mechanism. And there is a simple exercise that does exactly that. It uses the same biomechanical principle that professional freedivers use to dramatically increase lung capacity before an extreme deep dive. Here is how you do it. Stand up straight. Raise your shoulders toward your ears while simultaneously taking a deep, full breath in. Feel your chest expand to its absolute maximum. Then, Slowly and deliberately, lower your shoulders and exhale completely. At the end of the exhale, let your shoulders drop and fully relax. That's one repetition. Here is the physiology of why this works so effectively. When you raise your shoulders, you mechanically expand the upper chest cavity. When you simultaneously inhale deeply, your diaphragm drops downward, expanding the lower chest cavity. You are stretching two separate anatomical pistons in opposite directions at the same time. This creates a substantial drop in intrathoracic pressure. That's the pressure inside your chest cavity. That pressure drop generates a powerful suction effect that pulls lymph inward from the tissues of your entire body at once. On the exhale, when you lower your shoulders and empty your lungs, you compress the chest cavity again, preparing it for the next forceful inward pull. This cycle, repeated consistently, functions as a manual pump for your entire lymphatic system. Fluid clears from your face, fluid clears from your legs and arms. The puffiness recedes, not because of a massage that costs $200, but because of a breathing and shoulder movement you can do standing in your kitchen. Now, let's get into the clinical patterns I see most often in practice, because where the swelling appears on your body tells me something very specific. If your face is the primary problem, your body looks completely normal, your weight is fine, but every morning you look in the mirror and your face is puffy. Your eyes are swollen, your cheeks look waterlogged. In the majority of those cases, I'm thinking about old head trauma. Not a dramatic injury. Patients often don't even remember it. A fall in childhood, a collision, a sports impact. You hit your head hard and you moved on with your life. But at the microscopic level, the bones of your skull shifted slightly. The connective tissue that covers your skull and face, the fascia, was placed under chronic tension. That tension has never released, and it's been blocking lymphatic drainage from your face ever since. What I see clinically when that tension is properly released through manual treatment is remarkable. Patients' faces visibly lift, the puffiness resolves, and they look years younger without a single injection. If the swelling is diffuse, your whole body retains fluid. Your hands and feet and face all swell simultaneously. I am thinking about the spine and posture. When you spend years sitting at a desk, your spine compresses and rotates slightly out of alignment. That compression is transmitted to the muscles and connective tissue of your arms and legs. Blood vessels and lymphatic vessels that run through those compressed tissues get slightly kinked and narrowed. Think of a garden hose. Twist it tight enough, and the water stops flowing. The same principle applies to your vessels. When posture is corrected and muscular tension is normalized, the vessels straighten, resistance drops, and fluid drains. I see patients lose half a pound to a full pound of retained fluid within 24 hours of a single manual treatment session. And that's not fat, and it's not muscle. That's stagnant toxic fluid that was trapped in the deep tissues and finally got an exit. If the swelling concentrates in your legs, you get home in the evening and there's a deep red indentation from your sock elastic. Your legs feel heavy and difficult to move. I am thinking about the lower abdomen and core weakness. When your abdominal muscles are weak, your internal organs and your large intestine lose structural support. They descend. Their combined weight begins to press directly on the pelvic vessels, the large veins, and lymphatic trunks in your lower pelvis. That pressure from above physically blocks fluid from rising up out of your legs. Strengthen your core. Support your abdominal organs. Take the pressure off those pelvic vessels, and you free the flow. Leg swelling begins to resolve. Now there is a separate clinical scenario that I want to be very clear about because it requires a different response entirely. As the heart ages, its pumping capacity gradually declines. After the age of 60, age-related changes in both the heart and the vasculature, the network of blood vessels, progress roughly 3 times faster than they do in younger adults. When the heart is weak It genuinely cannot overcome gravity to pull heavy fluid-laden blood back up from the lower extremities. The result is cardiac edema, swelling caused not by compression or dehydration, but by an actual failure of pump function. This is a different medical story entirely. This needs a cardiologist. It requires a careful, individualized approach to medication. You cannot solve cardiac edema with breathing exercises and morning water. I want to be completely honest with you about that. How old are you? Write your age in the comments. After 60, the risk of cardiac edema increases dramatically, roughly 3 times faster than in your younger years. I want to see who in our audience is in that age range, because the advice that applies to you may be fundamentally different from what applies to someone in their 30s. Your age determines your risk group. Let me know below. Now let me tell you about the single best full-body lymphatic exercise I know of, one that combines every mechanism we've discussed simultaneously. Swimming. When you swim, you are horizontal, which means gravity is no longer pulling fluid down into your legs and feet. Every part of your body moves rhythmically: your arms, your legs, your core, your shoulders. That whole body muscular contraction drives lymph powerfully toward the center. You breathe deeply and consistently, activating that thoracic suction mechanism with every stroke. And the physical pressure of the water surrounding your body provides gentle, uniform compression across all tissues simultaneously. The same principle as a compression garment, but applied equally to every surface of your body. This is why you feel an urgent need to urinate shortly after leaving the pool. That is not coincidence. That is the toxic, stagnant fluid your tissues have been holding finally finding an exit. If you want one activity that does everything for lymphatic health at once, it is swimming. For general daily movement, don't fixate on a single body part. Spot exercises, working only your legs or only your belly, are the least efficient approach to lymphatic health. Full body movement, running, dancing, team sports, any activity that engages your whole system simultaneously produces the most complete lymphatic circulation. When the whole body moves, fluid updates everywhere. There are targeted manual treatment approaches for localized problems, specific compression points in the face, neck, lower pelvis, or limbs, but the foundational principles are the same everywhere. Remove the mechanical obstruction, restore the flow, give the fluid a path out. Here's what I want you to walk away knowing and doing. Lymph is silent. It never causes sharp pain. It never sends you to the emergency room at 2 a.m. with a crisis. It quietly backs up over years, and the symptoms accumulate so gradually that people adapt to feeling exhausted, puffy, and foggy as their new normal. Don't accept that. Start this week. Drink warm water every morning, not room temperature, not cold, hot as tea, between 700 milliliters and 1 liter, before you begin moving for the day. Watch your urine color. If it's not nearly clear, drink more. Do the shoulder raise breathing exercise daily. It takes less than 2 minutes, and it physically pumps fluid through your entire system. Move your whole body every day, not just a walk around the block. If your swelling is localized in your face, your legs, or your entire body despite these measures, see a clinician who understands the mechanical causes, not someone who simply writes you a prescription for a diuretic, which is a water pill that forces your kidneys to dump fluid without solving the underlying reason the fluid was trapped in the first place. Your health is a mechanical problem with mechanical solutions. You now have them. Your doctor at your next appointment won't bring this up. There's no billing code for explain the lymphatic system and fix it. There's real money in repeat visits and recurring prescriptions. That's the truth of how the system is built. I'm Sam Waterling, and this channel exists because someone needs to say it plainly. Subscribe to Dr. Waterling, leave a like, and hope this channel reach 100,000 subscribers. One thinking person at a time.